Built from the ground up, specifically for small animals, Hallmark offers an MRI solution that provides the highest quality diagnostic imaging with a practical business model and unrivaled support. With over 2 decades of experience and over 120,000 patient images, Hallmark is committed to providing access to state-of-the-art resources to clinics and practices around the world. Building on their unrivaled success in the equine market, Hallmark's 1.5T small animal MRI system has kept the patient and you at the forefront of every design decision. Your patients range from small to large, with anatomy that requires dedicated hardware and software to optimize image quality. With 16 channels to help you see more and scan faster, a V-shaped patient bed, veterinary-specific MRI coils, and a unique panoramic glass hatch, this self-shielded system delivers the specialized technology your practice demands. A sliding roller system allows for fast patient access in and out of the bore, which minimizes the time the animal is under general anesthesia. Optimum patient positioning is ensured with coils that feature an open-top design and a phased array system that enables the use of 2 coils simultaneously, allowing you to better image hard-to-reach anatomy. The panoramic glass hatch allows free access to your MRI room during scanning, and a dedicated video monitoring system further enhances patient safety. The advanced cooling system is designed to save you precious time and money. This includes a zero boil-off cold head that constantly recycles helium and eliminates the need for helium top-offs. The air-cooled compressor maintains constant helium levels at all times, even if the chiller defaults. Hallmark's world-class Q-Care service and support program confirms their commitment and encompasses all that they do as a team to support your business success. This includes the Hallmark 99% uptime guarantee, ensuring the care your clients need is available when they need it most. Innovation that works for you. Don't wait to take advantage of the latest technology. Partner with one of the most experienced animal MRI companies in the world. We speak vet at hallmark.net.
Welcome everybody from Facebook, Neurology for Vets, from myself, Simon Platt, and from Laurent Grossi. Good evening, good afternoon, good morning, wherever you're tuning in from. Please let us know. It's always good to know where everyone is, how they're doing. Thanks for tuning in. Today it is our pleasure to introduce to you a rising star in the veterinary profession, Dr. Alessandro Conte, and he's going to speak to us today about imaging of cranial thoracic vertebral canal stenosis in screwtail brachycephalic breed dogs. Before we get started, I'm going to just read a brief bio for Dr. Conte. He graduated from the University of Padua in Italy in 2012 and then moved to the UK in the same year. He worked 3 years in small animal practice in Yorkshire, in England, and then completed 2 rotating and 1 surgical internship in both private and university institutions in the UK. After returning to Yorkshire in 2019, Alessandro worked in a small animal orthopedic referral for 1.5 years, where he also completed certificate in advanced veterinary practice. In June of this year, Alessandro moved to Cambridgeshire to start an ECVS residency in small animal surgery at Dick White Referrals. So, welcome, Alessandro. Thanks very much for giving up your time. Based on your recent publication and study, we know that you're one of the rising stars in the profession. So we are now considered old has-beens, and we want to hand over the voice and to you. And so to get us started, I have a question for you, but do you want to
I will share the screen.
Yeah.
Can everybody see it?
Very good.
That's great.
Well, that's a great start.
Great. Perfect start. Yeah. And so right off the bat, first question is, what is cranial thoracic stenosis and why is it a problem in dogs?
I just wanted, firstly, before answering your question, just want to thank you very much for inviting me for this live streaming, and I'm very much flattered for this opportunity you're giving me, and I feel slightly out of place, I have to say, speaking after Dr. Da Costa and Dr. Rosebridge. But anyway, I think it would be useful to firstly describe what type of stenosis we can actually have at the level of the thoracic vertebral canal, which I believe will help us to clearly understand what cranial thoracic canal stenosis is really about. So we can have developmental stenosis, which are present at birth, and they have an active cause that remains present throughout the growth period of the patient, obviously until the vertebra reach maturity, as opposed to acquired spinal stenosis, which are instead the resultant of, for instance, ligamentous hypertrophy, intervertebral disc protrusion, degenerative articular changes, synovial cysts, and malarticulation or malformation syndromes. And finally, congenital spinal stenosis are instead present at birth, and they have no active underlying cause. So congenital thoracic spinal stenosis is usually associated with hemivertebrae, but also other vertebral malformation have been reported in the literature. So in a paper by Johnson and others, it's slightly dated, has been published in 2012, the authors have evaluated the clinical, the morphologic, and the morphometric features of cranial thoracic spinal stenosis in 79 MRIs of large and giant dog breeds. And in this study, which is the most comprehensive to date on the topic, it was proposed that a developmental etiology is the most likely explanation for the cranial thoracic spinal stenosis. And this is simply because dogs with clinical signs were presented with osseous morphological changes at a very early age. It was reported a median of 9.5 months, and therefore often before the full skeletal maturity of the vertebral canal. So with this beautiful 3D reconstruction of the first thoracic vertebra, which by the way, you can find it at the below address with many other 3D reconstruction, should you need that. We can hopefully appreciate the pathogenesis of the disease described by Johnson, in fact. So in the cranial thoracic spine, the orientation of the articular process in normal dogs produce quite a shallow angle, okay, with the dorsal plane. Instead, at most sites of cranial thoracic spinal stenosis, this angle was subjectively steeper, and the articular processes were more elongated both in transverse and paramedian images. And therefore, these abnormalities of articular process geometry may contribute to additional stresses on these joints and are possibly, or actually very likely, to play a role in the development of cranio-thoracic spinal stenosis in dogs. So in practice, just to summarize, the canal stenosis is caused by a developmental malformation of the vertebral arch as a result of the hypertrophy of both lamina and the articular process. And this can obviously occur mono or bilaterally. And we'll see if the video shows. So that's the cranial articular process, and then the lamina is here, and then this is the caudal articular process. So it can occur obviously monolaterally or bilaterally. This is going. Okay. So as you can imagine, this leads to a decreased dorsoventral or lateral diameter of the vertebral canal compared to the adjacent vertebrae. And affected dogs typically show clinical signs of compressive myelopathy, which is characterized by a non-painful progressive pelvic limb ataxia and paresis. I wanted to share a video, but believe it or not, we couldn't find a video of pelvic limb ataxia and paresis in large dogs other than German Shepherds. But fella was cheating.
So that there's a great start introduction. I love your illustrations there. They're fantastic. Well, so how would you usually diagnose this condition, and what breeds are predominantly affected?
So, cranial thoracic vertebral canal stenosis is actually a relatively uncommon vertebral malformation in dogs, and in the veteran literature has mainly been reported in large and giant breeds. So with regards to the means of diagnosis, as we know, magnetic resonance imaging, so the MRI scan, is the gold standard for spinal diseases because it obviously allows a direct qualification of the spinal cord. And the study really should consist of at least a sagittal, a transverse, and a dorsal T2-way images, and ideally also a T1. So this is an image that I took directly from the study of Johnson's, and as you might have noticed already, it consists of a sagittal two-way image of a craniothoracic spine. And obviously different colored lines represent the levels where the transverse images were obtained during the study in order to investigate and compare the spinal cord. So in figure A, which is a transfer T-view way image of a normal sighted T1 and T2, whereas the figure in B is the image of a severe grade spinal cord compression. In this case, is bilaterally. So we can see that here. And the image C shows how the compression is also present at the level, more caudal level of T4, T5, but to an obviously much lesser extent. In fact, there is dorsal attenuation of the epidural fat. There is dorsal epidural fat and subarachnoid space, but no actual cord compression, as we can see. So it's still present around, but the spinal cord is not compressed. So despite being, as we said, the gold standard for investigation of the spinal cord, the MRI comes with some pros, but obviously with some cons. So surely it provides superior soft tissue resolution, and it allows the acquisition of much more information on the spinal cord integrity or pathology. However, it can be quite costly, quite expensive, and for this reason, it's not so widespread in the veterinary profession, as also, as you can imagine, is contraindicated in patients with pacemakers and more frequently with metallic implants. So for this reason, I wanted also to compare the computed tomography as an alternative image investigation for this specific disease. So these images that I'm showing are a plain sagittal, the transverse, and the dorsal view in bone window of a normal craniothoracic spine. And obviously, contrast medium can be administered either intravenously or intrathecally. But why CT scan can be useful in the diagnosis of this specific disease? Well, as you can see, it can allow a beautiful 3D reconstruction of the study, which I found extremely fascinating. And if you have a lot of time spare, which I used to have before starting my residency, and if you're really bored, you can actually look for the stenosis yourself by trying to understand where the location of the disease is, and cutting the areas that you don't need, and isolating even the affected vertebra only. And in this case, we can see is at that level there. So in this specific disease, CT scan can be quite useful because it offers superior bone tissue resolution compared to MRI. It's not invasive if you consider the plain or, I suppose, contrast enhanced CT, and often more readily available than the MRI scan. That said, intrathecal injection of contrast is still very much required for the identification of some pathologies, and moreover, it provides little information on the integrity or pathology of the spinal cord.
Great stuff. So you've done a study on this problem in the screwtail breeds, brachycephalic dogs. Can you go over the importance of this study and how you conducted it?
Yes, so we published this paper on thoracic vertebral canal stenosis in screwtail brachycephalic breed dogs, say fairly recently. Well, it was available online on December 2020 on B-Course ahead of printing, but actually was printed in May this year. And this was a study that actually was born as a case report of 2 dogs only affected by the disease, and I started when I was a rotating intern at University of Glasgow. Beautiful city that I would recommend going visiting if you don't mind that there is not much sun over there, but other than that, it's beautiful. People are very friendly as well. So as we know, flat-faced dogs, so these are named brachycephalic screwtail breeds, are overrepresented for diseases caused by vertebral malformation, and typically these have different breeding distribution. So we can have spina bifida or spina bifida, which in pugs is commonly an incidental finding, whereas in French and English bulldogs is pretty rare. In general, vertebral body formation defects such as hemivertebrae or butterfly vertebrae are rare in pugs, but when they're present, are likely to be clinically significant in young dogs, whereas in French and English bulldogs are commonly an incidental finding and rarely actually cause neurological deficits. Caudal articular process, aplasia or hypoplasia, is a common finding affected caudal thoracic and thoracolumbar regions in pugs, French and English bulldogs. Transitional vertebra is a common incidental finding in pugs, whereas in French and English bulldog is instead an uncommon incidental finding. Both pugs and French bulldogs are one of the most commonly affected breeds by spinal arachnoid diverticula at the level of the thoracolumbar region, and they typically show progressive neurological deficits. And finally, meningeal fibrosis has shown a possible breed predisposition in pugs. Well, so far in this breed, thoracic vertebral canal stenosis secondary only to the hypertrophy of the vertebral arch component, as I said before, so similar to the one affecting large giant breeds described by Johnson, has been only suspected in 2 case reports based on post-mortem and radiographic changes. So the objective of our study were to describe clinical and advanced imaging features of screw-tailed dogs breeds and pugs with thoracic vertebral canal stenosis secondary only to the hypertrophy of the vertebral lamina and the articular process, causing associated neurological deficits. It was also to evaluate the prevalence of this type specific of malformation in CT studies of a large group of screw-tailed dogs breeds and pugs, with, however, no associated neurological deficits. And finally, to compare the degree of vertebral canal stenosis between dogs with and without neurological deficits. So the study was designed to be a retrospective study, and the medical records and advanced images studies from 7 different referral institutions were reviewed between a period of 11 years. And this study was also approved by the Glasgow Vet School Ethical Committee. So, Group 1 consisted of neurologically affected cases, as I said, in which the vertebral stenosis was only secondary to the hypertrophy of the vertebral arch diagnosed on MRI. Complete medical record and availability for review of the MRI studies were obviously considered an essential inclusion criteria. Whereas the exclusion criteria was represented by the presence of other potentially compressing lesion of the spinal cord, which could have caused realistically the clinical signs. Age, diagnosis, breeds, gender, presenting clinical signs, duration of the clinical signs prior to presentation, treatment, and short and long-term outcomes, so more than 6 months, were retrieved from the medical history or were retrieved by contacting the owners over the phone. Group 2 was instead represented by neurologically healthy cases which underwent a CT scan of the thoracic vertebral column for reasons completely not related to any neurological investigation. And dogs were excluded from this group if they demonstrated any gait abnormality or if the clinical records indicated the development of gait abnormalities later on in life. For both advanced imaging investigation, the study were post-processing multiplanar reconstruction, so in MPR, and this allowed the accurate identification of the vertebral stenosis sites and also to qualify the type of stenosis, whether it was right-sided or left-sided or a bilateral with a dorsoventral, dorsolateral, or only a lateral compression. So here things get a bit complicated, I hope it's clear. So for each dog, we calculated the cross-sectional surface area at the level of the stenosis in transferred images. And this measurement was called capital A when it was measured in MRI, and lowercase a when it was measured in CT scan. Equally, the cross-sectional surface area was calculated at the correspondent anatomical level of the first normal cranial vertebral space. And this was equally called capital B when measured in MRI and lowercase b when measured in CT scan. And finally, in order to standardize or trying to standardize our data between the groups, we did a ratio between the maximal stenotic area and the correspondent normal cranial area. So how does it translate practically? So these are the sagittal, transverse, and the dorsal view of a T2-way MRI of the spinal thoracic spine of a French bulldog included in the group 1. So as you can see, in the transverse view, the right articular facet, which appears black in T2, is protruding into the vertebral canal and compressing the spinal cord dorsolaterally, as we can see here. And obviously, the red figures represent the cross-sectional surface areas. And in this case, it's named A because it's an MRI. Equally, this is the MPR of a CT in-bone window of the thoracic spine of an English bulldog belonging instead to the group 1, so the non-neurologically affected. And in this case, the lateral compression of the spinal cord was from the left side. And in this case, called lowercase a because measured in CT. So with regards to the results, the dogs included in group 1, so the neurologically affected ones, were 12, specifically 7 English bulldogs, 4 French bulldogs, and 1 pug. All dogs were entire, and the majority was male, and at the age of initial presentation varied between 4 months and 7 years. I wanted to show you more into detail the degree of the disease that we found in the neurologically affected dogs, and apologies for the quality of the images, but as you can imagine, I had to zoom quite a lot, so the sharpness of the image is not that great. So I'm going to show you the transverse views of T2-way MRIs of thoracic vertebral column of 4 different dogs. And so this image in particular showed the normal appearance of the vertebral canal of the cranial thoracic region. If you then look closely in this other case, the articular facet and the lamina are protruded into the vertebral canal and compressing the spinal cord dorsolaterally from the right-hand side. You can see it here. In this case, from the left-hand side, and in this case, bilaterally. It's quite impressive, actually, this one. In group 1, the 19 stenotic sites were included for data comparison. And as you can see from the table, it appears evident that the stenotic sites were mainly located at the level of the first 4 intervertebral spaces and presented mainly a bilateral compression. The dogs included in group 2, so the clinically healthy dogs, were 41 English bulldogs, 60 French bulldogs, 6 Boston Terriers, and 68 pugs. And of these, only 16 English bulldogs and 19 French bulldogs presented subclinical vertebral stenosis for a total of 64 subclinical stenotic sites. And also in this group, the majority of dogs was male. So as per the MRI images, the following are the transverse view of CT scans in bone window of the cranial thoracic vertebral column of 4 different dogs, including in group 2. So this image showed the normal appearance of the vertebral canal, whereas in this case, the articular facet and the lamina are protruding into the vertebral canal and compressing the spinal cord dorsolaterally from the left-hand side. Pretty obvious, yeah. In this one from the right-hand side, and finally in this one bilaterally. So from this table, which is only considering the English bulldog subpopulation, it appears evident that the majority of the stenotic sites were also located at the level of the first 4 intervertebral spaces. However, in this subgroup, a left-sided compression was more frequently seen. In this other table, which is instead considering the French bulldog subpopulation, shows also a more common location of the stenosis at the level of the first 4 intervertebral spaces, again with a left-sided compression being more frequently diagnosed. So there was a statistically significant difference between the maximal stenotic area and the corresponding normal cranial area calculated in MRI and CT. And specifically, the vertebral canal in group 1 resulted to be approximately 25% smaller at the level of the maximal canal stenosis compared to group 2. So this is a box plot diagram visually describing the different data distribution of the ratio in neurologically affected and non-neurologically affected dogs. And for those who are not familiar with this diagram, as I was at the very beginning, the box itself shows where the 50% of the cases lay. the end of the lower whisker representing minimum volume, and obviously the end of the upper whisker representing maximum volume, whereas the line within each box representing medium of the group. As you can see, there is some overlapping between the two groups, but the difference was still significant. So in our group, in our study, most cases with vertebral canal stenosis were male, so specifically 75% in group 1 and 82% in group 2. And this predominance of male dogs in both groups is consistent with the results of previous studies in large brachycephalic dogs. And because large brachycephalic breeds and screw-tailed brachycephalics share a common ancestral Assyrian Babylonese genetic pool of molosser-type dogs, it is therefore very likely that genetic factors are involved in the pathogenesis of this disease, for which male dogs are overrepresented. Interestingly, no pugs were found to have subclinical stenosis, so to belong in group 2, and among the dogs showing neurological deficits, so in group 1, only one pug was affected by the malformation. In this dog, the compression was located at the level of T11 and T12, and as we saw, this is consistently different from the location of the overall stenosis in both group 1 and group 2. And also, the only neurologically affected pug in our study was significantly older at the initial presentation, so it was 7-year-old, than the rest of the other group that had a median of 6 months of age. I hope you can agree with me, but I think this is a truly revealing image taken from the study of Parker, published in 2017. So they specifically looked at how genomic analysis revealed the influence of geographic origin, migration, and hybridization on the development of the modern dog breeds. And this is specifically a cladogram of 161 domestic dog breeds. And the breeds that form unique clades are spotted by 100% of bootstrap and are combined into triangles. For all the other branches, the gold star, is a star, not a little dot. Well, I thought it was a dot, but it's actually a star, is equal to 90% or better. The black is equal to at all.
Fantastic. Yeah, a lot of work you've done there. Excellent interpretation of it, and thanks for relaying that to us. Based on the results you got, what does this mean for these breeds, and how is it relatively important compared to their other issues?
Yeah, so cranial thoracic vertebral canal stenosis was observed in our study predominantly in young male screw-tailed brachycephalic dogs, so English and French bulldogs, which is potentially the result of, as I said, the genetic link with molosser-type breeds. And the stenotic size, as we said, was mostly observed at the level of T2, T3, and also T4 and T5, warranting the necessity of a thorough imaging investigation of the thoracic vertebral column. The vertebral canal in neurologically affected screw-tailed breeds, brachycephalic dogs, was 25% approximately more stenotic compared with non-neurologically affected dogs. However, as the condition was also relatively common in clinically unaffected dogs, so approximately 20% in our study, I would say that its relevance should be cautiously considered, especially in the presence of other vertebral abnormalities that could potentially explain the clinical signs.
Right, and I guess the million-dollar question is how do you treat this, and what prognosis do you give for it?
Yeah, so in the reality, there is very little information available in the veterinary literature regarding both treatment and prognosis of cranio-thoracic vertebral stenosis in bulldogs. So as I said before, there are only 2 case reports describing the presence of thoracic canal stenosis in 3 English bulldogs, in which the disease was diagnosed via amyelogram. One of them underwent dorsal laminectomy with a successful outcome, whereas the other 2 were euthanized due to the severity of the clinical signs, so we'll never know. Although surgical techniques aim to obviously achieve spinal decompression, such as dorsal laminectomy in case is a bilateral compression or hemilaminectomy in case it is monolateral, have been equally reported in large brachycephalic breeds with good outcome, medical management has also been described in a few cases. So patients treated conservatively, they were reported to have a successful outcome. However, they continued to have neurological deficits. And likewise, in our study, good outcome was noticed in the 4 dogs treated conservatively, as well as for the 3 dogs which underwent surgical intervention. So specifically it was an English bulldog, a French bulldog, and a pug. And all dogs but 1 improved significantly or returned to be clinically normal. And only 1 dog, which was the medically treated, remained neurologically stable with an unchanged degree of ambulatory parasparesis and ataxia. I would say that said, given the limited number of dogs, including group 1, and the lack of follow-up information in all dogs, including this group, at present, no real conclusion can be drawn regarding the best treatment option for this disease in screwtail brachycephalic breed dogs. And I would like to thank you once again all the co-authors for this study, and in particular Rodrigo Guterres Quintana, who has been extremely supportive supervisor from day 1 to the final publication of this study.
Simon is muted. Let me unmute him.
Yeah, sorry about that. Thanks very much for that, Sandra. That really was a great presentation, very clear, and obviously a lot of work, as you said, and help advance this area, which we don't know too much about prior to this. So thanks very much for that.
Thank you.
So if you have any question, please feel free to put it in the comment box. I will put it to Alessandro. I think, clinically it's a very good message, but when you localize a dog to T3, L3, when you investigate this dog, ideally you need to image from, cranial thoracic to the mid-lumbar region. We know it already with, large weight dog, German Shepherd dog. If you find a disc protrusion in the thoracolumbar spine, always important to image as well the cranial thoracic. You may find another disc protrusion. You may find this malformation as well. But even more now, this study showing that in this, screw tail breed of dog, to really image the entire thoracic spine and not only the thoracolumbar, spine. So there is a question from Karin. I will put it on the screen. Maybe I miss it, but what was there a maximum age for inclusion in your study?
For the group 1, for the neurologically affected dogs, no, because otherwise we would have ended up with only a couple. So we tried, the main aim of the study was to retrieve as many cases affected only by the disease, and as you can imagine, has been very difficult. Quite a lot of, I've been bothering quite a lot of neurologists in the UK, and they went through the MRIs, and we only found 12 dogs, which I think is still quite remarkable. And with the others one, we didn't know, because the CT scan were retrieved by an archive of, it was a huge archive, and they were mainly related to investigation for Boas syndrome. So we didn't know really the age of them.
If there is any other question, please put it. In the meantime, I'm going to ask you a question as well. How many of these dogs had surgery? You say that had dorsal laminectomy, and you say
in our study only 3. So an English bulldog, a French bulldog, and a pug. So the 2 bulldogs had a laminectomy, whereas the pug dorsal laminectomy.
And did you take the wool? Did they take away the wool spinous process, or only part of that?
Yeah, as much as we could, really. The thickened.
The entire. Okay.
Yeah.
The entire spinous process they took, or
Yeah.
okay.
Yeah,
That's one of the concerns I will have with this technique, especially in the cranial thoracic spine. You got obviously the nuchal ligament that attach on T1, T2, and to some degree T3.
Yeah.
I think, Simon, you remember German Shepherd dog at the HT. The dorsal, the interspinous process there is very important for stability. And
course,
you got, especially on
quite
this,
close there, yeah.
Especially on this, breed of dog with a very heavy head, and the nuchal ligament pulling on the cranial thoracic spinous process. There's always a risk of, instability dorsally there. And it's more for everyone listening. There is a very nice paper from Frank Forter published in Vet Surg about 14 years ago that show a really nice technique, to manage dorsal laminectomy in this dog, where Frank described a partial osteotomy of the spinous process. So what it does in this study, he only remove the bottom third of the spinous process to leave the top 2/3 of the spinous process. And therefore, by doing that and only opening on one side, he avoids obviously stripping the muscle on the contralateral side, but he also maintain all the interspinous process, in order to limit this instability, and I think it's a very nice, little technique, especially in the cranial thoracic spine, where, I'd be worried about instability. Maybe go fine, but I think by doing so, it gives you enough exposure. You only open on one side, and you keep this osteoligamentous dorsal stability, which I think can be quite useful. So I think there's a couple more questions. I put this one. From Ethan, in case of multiple lesions observed in the MRI scan, how would you choose the clinically relevant location for surgical treatment?
Well, that's a great question. I suppose we are talking about the stenosis, so specifically on the stenosis. Yeah, so we had this conversation with Rodrigo about this, and I suppose the idea was this is the overall idea of this paper, like to find and measure where the stenosis most severely affecting the spinal cord, so compressing the spinal cord. And I suppose you go there, and it depends how many sites are involved, and how long is safe really to perform multiple site surgery. But definitely by performing and by calculating cross-sectional surface area, you got an idea where the compressive myelopathy is more severe.
And I think that's, for all these dogs, that's the $1 million question. When you got multiple compression, but you could apply the same when you got a dog with multiple disc protrusion,
exactly.
lumbar spine. How many you do, and which one are more relevant, and there is very likely a combination of cumulative effect and acute and chronic deterioration and so on. So I'm afraid Ethan is a hard one, and I don't think there is a clear answer for that one. There's another one from Karin again. You got an admirer, it looked like. In your opinion, experience in this study, do you think the length of the compression is of any relevance in causing clinical symptom?
I'm not sure I can answer. I would imagine no, really. I mean, this is a developmental condition, so clearly maybe it's obviously not present when the dog is very young, and then progressively becomes more ataxic and paretic. So so it depends, really. I'm not sure how to answer. I'll say yes. Actually, I changed my mind.
I'm not sure I understood, Karin. If you want to put some more, comment about that, because the length of the compression, I presume, that apply for disc extrusion where the material may spread, but there it's a quite focal.
Oh, was it the length of the compression in terms of timing? Oh, sorry, I thought it was in terms of timing. How long the duration.
Okay, I thought the length.
But I'm not sure, maybe the physical length.
And I think you're right. Is the length on that?
The length of compression. Duration of compression.
I think it's the duration.
On that subject, did you think about doing any volumetric studies? Let's say it was length of the compression itself. Was there any thought with the 3D possibilities of doing a volumetric study rather than, say, an area 2D study?
Well, that would have been very cool actually, but I suppose only in CT scans. Yeah, so because it would have been nice actually, yeah, definitely. But the MRIs dogs, I'm not sure you can actually get into details as per the the CT scan. Yeah,
I think, and we're still probably left wondering really, what does it mean?
True. Yeah. Surely possible on CT scan, but not. I don't think it's feasible for the at least the anno. Did
you do? And I may have missed this. So sorry if you said it, but did you look at this cervical column in these dogs as well? Or was it maybe not available?
No, it wasn't. No.
Okay. I was going to be interested as to whether they had any central canal dilation that was more significant than just a visible central canal.
No.
I think what Karen was saying, the length of the compression of the cord, which is a bit the same question, same question as Ethan, which is the number of area of compression, because it's not a continuous compressive pathology.
Yeah. I don't think multiple sides then. So whether one or multiple sides, I don't think it will make. Yeah, I don't think it makes any difference really, because you can have only one stenotic site, but it's extremely compressing and causing like a huge compressive myelopathy, and having multiple milder ones. So no, not really, no.
Good. There's no more question. I think Alessandro, you've worked enough for tonight, especially after a day on clinic. Yeah. Thank you so much again for.
Yeah, I'm calling from within the hospital. Yeah.
It's and being very brave and deciding to put forward your study. We very much enjoy it, and I hope everyone else also enjoy. Thank you so much to everyone for listening.
Thank you.
And we hope to see you soon. Have a good day. Bye-bye.
Yeah, thanks everyone. And thanks to Hallmark as well.
Or good day. Bye now.
Thanks. Bye-bye.